Hi everyone, my name is Cedric Daniega, and today I'm going to be talking about the misuse of the drug fentanyl, especially in teens and adolescents. So why don't we start here and look at the overview. Why exactly is the misuse of fentanyl a public health issue? Well, in comparison to morphine, fentanyl is a strong synthetic opioid analgesic that is 50 to 100 times more potent. Fentanyl is also used as a pain reliever that is both illegally produced and prescribed. Fentanyl is one of the synthetic opioids and is the substance that causes overdose deaths the most frequently. And because fentanyl is often blended with other drugs, individuals are frequently unaware that it contains fentanyl, which increases the chances of overdose and could lead to death. In addition to being marketed as a powder, illegal fentanyl is also made into tablets that resemble actual prescription opioids and is usually distributed as eye drops, nasal sprays, and even blotter paper like small candies. Next, let's talk about the severity of misusing fentanyl. Here on the right, we have a graph that's of the national drug involved overdose deaths number among all ages 1999 to 2020. And so, in a recent article, it was said that the rise in unintentional drug overdoses has led to 200,000 years of lost life for US preteens and teenagers who had passed away between the years of 2015 and 2019, as the study showed. Now, more than 1 in 4 pills are laced with poison. And according to the CDC data, did you know that 62% of drug overdose deaths in 2020 were caused by synthetic opioids, specifically fentanyl? Now, since the beginning of 2014, there has been a dramatic increase in overdose deaths with synthetic opioids other than methadone, but we're looking at specifically fentanyl. Now, fentanyl, which is 50 times stronger than heroin, may kill someone with just 2 salt-sized grains. That's, again, 2 salt-sized grains of fentanyl could just kill somebody. And lastly, in recent months, fentanyl has also been discovered in vape pens in high school campuses. Now, let's also look at the interventions and strategies that we have available to us and that we can suggest here. So, parents should observe their children in cases that they are trying to look for an escape and maybe misusing fentanyl or other substances to help them escape. Secondly, using the drug naloxone, which may be given to a person to reverse a fentanyl overdose. Now, due to the high potency of fentanyl, several naloxone doses may be necessary. It is also recommended to speak with a school counselor, a drug counselor, a mental health professional, or schedule a substance use screening with your child's pediatrician if you have any reason to believe that your child is abusing any opioids or other drugs like fentanyl, and calling 911 in the case that you or someone has a fentanyl overdose. And simply don't take drugs that aren't for medical use or prescribed by a medical professional. And so, in conclusion, as cases of drug overdoses increase every year more often nowadays, especially with the misuse of fentanyl, it's important that we take the proper interventions and strategies provided to us to prevent further cases of fentanyl overdose and deaths, especially in teens and adolescents. Thank you.